this video, we're going to show you exactly what your specific condition entails, how to properly treat it, and maybe more importantly, how to keep that pain from coming back for good. Hi, I'm Johnny with MJ's right here in Fulton County, Pennsylvania. I've been treating this area and the surrounding areas for well over 12 years. I have 30,000 plus hours of actual hands-on experience in eliminating conditions just like yours. I hope you find this video valuable, and thanks for watching Pain Elimination TV. Alright, so let's take a look at your specific condition, sciatica. And when you think of sciatica, look at this massive nerve coming down through some very tight spaces. And boy, can it cause extreme pain and interruption in your life. But before we get to the details of what all is happening here, let's take a look at some of the motions that are incorporated in the hip joint itself, so you can have a better appreciation of what's going on with all this underlying muscle tissue and how potentially the sciatic nerve can get pinched and become a huge problem. First, let's take a look at our hip flexion. Now, here is a muscle that we're going to talk a good bit about. And for anyone who comes to me on any kind of regular basis or have been to me for problems of their own in the past, they know without a doubt what this particular muscle is. It's the good old psoas. And this muscle here, the iliacus. Put together, we like to call them brother and sister, and pretty much we would refer to them as the iliopsoas. But just get a good understanding of what you're seeing here as far as the motions of the hip from all the different specific angles. And here we have some hip flexion. This is one of the actions in particular that can cause people a fair amount of sciatic pain, hip pain in general, and potentially some significant low back pain. And here we have some medial rotation. A lot of therapists never spend a lot of time on these particular abductors, but these particular muscles can become extremely painful, extremely tight, and for some people these muscles can get so bad on restricting rotation and they can barely spread their legs, if they can spread their legs at all. So these muscles are very important. They do play a role in sciatica, but not near as much as some of the muscles we're going to talk about here in a few moments. Now here you have some lateral rotation, and we're going to get into this particular motion in pretty good detail, or at least the muscles that are incorporated in this particular motion, because you'll see here when we get to the new screen of just how the sciatic nerve is going to come through muscles such as the good old piriformis and the gluteus medius and a few of the other rotators that are located back here. And when those muscles get inflamed and when they get chronically shortened, you can experience quite a bit of pain. And here you have some hip abduction. Now you get to appreciate with each one of these scenes I'm showing you as far as different forms of movement that the hip joint can perform. You're getting the pleasure of having the muscle tissue broke down into only the muscles that are involved in that particular activity. So you're getting a real good view here of what's going on mechanically. You'll get to see here in just a moment how all these muscles and nerves and fascia are intertwined, and just how intrinsically involved this area is. And last but not least, hip abduction. Big powerful muscles in here. The abductor magnus and abductor longus peneus. But these go up and they attach right in here to the pubic bone region, and they can actually throw the entire gait off, which of course can lead to other problems such as sciatica. They can create a lot of pain, and they can really throw the gait off. If you never have anyone from a therapy perspective, if you're dealing with some gait issues, some low back issues, and some sciatica, if your therapist is not looking into these areas and really checking them out, that therapist is not doing you justice. These areas should not be taken lightly. Now let's take a closer look and see exactly what you have going on here. When you look at the sciatic nerve itself, it's probably the biggest nerve in the body, and it comes down through a highway of muscle tissue. Now, if you remember from some of the things that you just saw, the different activities that the hip joint can do, you saw a lot of other muscle tissue that's not visible here at the moment, so we can get a really good look at the sciatic nerve. If you look over on this side, you can see a lot more of the muscle tissue. So it's a very, very busy active area that goes through quite a bit of abuse, has some very important purpose to it. And this muscle right here, the piriformis, which is a major rotator of the hip joint, it can get very, very, very tight and inflamed. And typically when that particular muscle gets tight and inflamed, it'll tighten and inflame its brothers and sisters here. Now the superior gemellus, the obturator internus, the inferior gemellus, sometimes the quadratus femoris, and your gluteus minimus. Specifically, let's take a close look here though. Usually when this muscle gets chronically short and spasmodic, inflamed, anything of that particular nature, these here will respond as well. And these are powerful muscles, although they might look quite small. And what you're going to have happen at that particular moment is you're going to have this huge nerve that's going to be thrown up against your actual hip bone. Okay? And when that nerve gets thrown up against the hip bone, it's going to refer pain, weakness, numbness, potentially all the way down to the toes. Now, a lot of people, unless their sciatica is extremely out of control, they will only feel the pain, weakness, and potential numbness sensations and so forth down to the outside of the knee. I told you we would be taking a close look, and anyone that comes to me on any kind of regular basis or have been here for any kind of low back pain or sciatica or gait issues of any kind, we want to take a close look at the iliacus and the psoas. Some very big, powerful muscles that come in through your actual pubis bone. Okay, and they come over, they attach to the actual femur, and they come up and attach to the spine itself. So they're starting on the front, the anterior portion of your body, going through at an interesting curvy roller coaster type angle, and then coming up and actually attaching to the lower spine. Now, these particular muscles are hip flexors, and very, very powerful muscle. Probably some of the most powerful muscles you have in your body, and in my opinion, one of the absolute most important muscles in your body to keep as happy as possible. When this muscle goes into spasm or becomes chronically shortened and dysfunctional, it will actually take the entire gait and shift it, rotate it. And typically we find that the ilio-psoas problem is typical on one side of the body. Every once in a while we do run into somebody that has dysfunction on both sides of the body, but one side is usually the main cause. When it shifts the hip out of place, it's then going to put pressure on the piriformis and his brothers and sisters. It's then going to pinch the sciatic nerve and send pain, numbness, weakness, all the way down through the leg, and potentially halfway up the back, about to the mid-back, where you start to find that a lot of people like to bend at. A lot of people that end up coming into our office at MJ's for low back pain don't truly have low back pain at all. They either have referred pain from the sciatic issue traveling back up the body, or they have referred pain from the psoas because the psoas actually attaches to the lower lumbar spine. Now what we do at MJ's is we are going to definitely use some deep tissue work and some myofascial work and some activated stretching, some great passive aggressive stretching to open up the piriformis and its sisters and brothers here. And we're going to get into some of this deeper ligament tissue as well that's going to come over and be attaching to your actual sacrum. We find a lot of disruption here in this area, and if you see where some of this is coming across and attaching, it's going to play a huge role in whether or not there's enough open space for this sciatic nerve to come through freely and comfortably. With your sciatica, we're also going to pay a lot of attention to the psoas and the iliacus. We do some pretty interesting and some extreme stretching for these particular areas so that we can release all the tension and allow the gait to walk out. A lot of people come into our office and they can be anywhere from 1/8 of an inch to 3/4 of an inch off in rotation, which has them walking around on at least 1/8 of an inch to 3/4 inch short leg. Once we release these two muscles, it allows that portion of the gait to shift freely to where you then for a temporary period of time have balance, because it is a muscle memory problem that needs to be thoroughly retrained. To get relief now while you're waiting to receive the proper treatment, you would want to place ice over this specific area. You would want to avoid doing any kind of inclines, walking up a whole lot of steps, taking a walk up an incline if you're somebody who likes to exercise, anything that's going to greatly incorporate this muscle group and the gluteus maximus and the gluteus minimus, because that will then tighten those areas and put a lot of pressure on the sciatic nerve, because there's going to be a lot of inflammation trapped in here, which is taking up space. You're going to want to stretch the psoas and the iliacus. And in future videos, if you sign up to get further information and detail on this particular condition, we'll send you some stretches that can be done for this particular muscle group that will take pressure off the spine, allow the gait to level out, and will allow these muscles to then relax and have proper space. A lot of times we feel pain on the back side of our body, but the back side of our body is typically just a symptom. Even though sciatica is happening in this region isn't the culprit. That's why a lot of times if you go to receive some kind of therapy, you may walk out with temporary relief but not long-term relief, because they'll focus on the immediate area of the issue. The problem actually starts here on the front side of your gait. Once you have rectified this problem completely with the proper treatment, the way to keep this from coming back is to be mobile. A lot of people have, in today's world, very sedative lifestyles due to certain career paths, and this area is not getting enough opening. The area closes and becomes a closed, repetitious memory to the muscle tissue because of our sitting positions. So you would want to get up, and you would want to be open. You would want to stand as erect as possible and move around. Now you would want to stretch these rotators, which we'll have for you in future videos, but you would want to stretch these rotators as much as possible, and stretch the psoas here as much as possible. But then what you would want to really do, it goes back once again to weakness. A lot of times our problems that we experience here at MJ's is the area that is overused and abused doesn't have the strength to manage the everyday activities in which it's involved in. So you would really want to work on these areas here, here, and of course the big muscle that's covering all this area. You would want to work on actually strengthening those so that they're no longer a weak spot, to avoid sciatica from returning. So we hope that you have a better understanding of sciatica and what you look like underneath all that skin and fascia, and seeing what the problem truly, I mean, if you have to admit, this is a pretty impressive picture. I hope the time you spent watching this video was valuable. Now, if you want to be pain-free within 30 days or less, please give me a call. Let's talk. Phone number is 717-404-6495, and you can sign up for our pain elimination package, which guarantees with your specific condition we will eliminate that pain in 30 days or less with a satisfaction guarantee. If you're not satisfied at the end of the 30 days, you get your money back. And our pain elimination package is half price. So if you want to get rid of your pain in 30 days or less, give me a call. And thanks for watching Pain Elimination TV.